house, on an evening, in your neighborhood, dinner is being prepared. The mother is cooking. The father is on his phone, and the children are playing in the living room. Then suddenly, the father leaves his phone and heads to the kitchen. He starts shouting. The children pause. They hear their mom screaming, broken glass. They are afraid and helpless. They hear the sound of the ambulance. "Mommy will spend the night in hospital," says Granny, as she comes to spend the night looking after them. What they have heard, witnessed, and felt will change their lives.
I think there is a correlation, often a correlation, between domestic violence towards a partner, for example, and domestic violence towards children. If there is a family member who has witnessed violence as a child and is perpetuating the cycle, they may be violent toward their partner and the children, or just toward their partner. And this is something that's very difficult to differentiate and needs to be explored.
When my son was 14 years old, he witnessed everything. One time I had to start shouting, "Help me, help me," because their father was strangling me and threatening me with a pair of scissors. My son and daughter came running and observed their father's hands on my neck.
The direct effects that you can see in children who witness domestic violence with their mothers, the most common is changing of the behavior. You can see sometimes behavior problems, or children start to behave in another way they used to, and can be more scared or even afraid all the time. Or sometimes you also can see the kids start to be more aggressive. The indirectly effects in long terms with children who are witnessing this kind of situation can be psychiatric disease, such as anxiety, depression, and we can talk also about trauma that can development several consequences like neurological, cognitive, and behavioral consequences.
When they saw the last aggression, my daughter and my son grabbed their father and said, "Let Mama alone. Let Mama alone." They would stand next to me so that he wouldn't hit me. The time he hit me, my 3-year-old daughter told her father, "Mama's good. Mama's very good. Why did you hit her?"
We see the effects on children when they have difficulties in their families, and this can be, it doesn't necessarily have to be violence, but it can be violence or abuse. And there's no question that medical professionals are in a role where they can intervene. We see children in the emergency room, no matter what our specialties are, we see children that come into the emergency room and we see the families right away, and sometimes we have a sense that something's not right. Sometimes it's the behavior of the mother around the father, or just something in the room. And this is the moment where we can intervene, where we can talk to the mother alone and ask her if she's safe. Of course, if we are worried that the child has actually been a victim of violence, then it is our obligation to investigate that further. But even if it's more focused on the mother. Our concern as pediatricians is always the health of the child, and there's no question that the health of the mother largely affects the health of the child. I think it would be important to integrate things like intercultural communication in the medical curriculum. It's the first step. The medical studies have evolved a lot over the last years, decades, for the better, and that there's much more focus on the patient as a whole. But a patient as a whole includes the social context as well. And if medical students are taught from an early stage that this is part of taking care of their patients as much as listening to their lungs, then they will continue their training prioritizing this.
My son has beaten me. I know he suffers because after the beating, he comes to me, cries, and says he is sorry. He sometimes acts just like his father. One thing that really worries me is what will happen when my son has a girlfriend. I don't want him to beat her because she tells him she wants to end the relationship, or because he sees her with another guy. The same story could be repeated all over again.
The best way to reach the kids is communicate with them. But why kids communicate and how they communicate about their own language, and the own language of the kids is playing. So the most important thing to learn is how to play with a kid. And if you are playing with a kid, you can reduce the barriers that the kids are in any situation. So it's interesting when you use art or play therapy with the kid. So the kids can draw, the kids can play, and also in this situation we use like non-verbal communication. And when you use non-verbal communication with the kids, they are more open to talk about their feelings, their fears, and what they want and what's happening in the house. And another way, nice way to do it's role playing and pretend play. It's also a good strategy that can use even when you are in the doctor context or in a school context. One example that we can use for understand more the emotions through the drawing, it's drawing with the kid. When you tell the kids, draw this, or draw your family, draw what's happening in your house, that's not the right way to go. It's better if you sit with the kid together and let's draw together. I will draw my family, I like to do this, I like when my mom do, I don't like when this happen. And the kids start to talk when they start to drawing. And it's the way that we can avoid another trauma with the kid.